Good afternoon, and thank you to Grant and the team for inviting me here today. We're going to take a little bit of a different turn here, and I think before we start, there's probably one question that I would like to sort of tackle over the next couple of minutes, and that's, can a topical formulation actually impact on the outcomes of invasive body contouring surgery? And this is a question as a plastic surgeon that I've asked myself over the last couple of months. But it really, disclaimers, it really hasn't some sort of emanated one day, woke up and said, well, let's create a formulation that we can use for body contouring surgery. It really emanated from 3 products that we worked up over the last couple of years and decided that, well, if we could take those 3 products and merge it into one, this is going to be the ideal kind of peri-surgery, peri-invasive surgery kind of product. So just to give you a little bit of a background, there's been a lot published, and we've published a lot of different papers, clinical science background, clinical trials related to all 3 of these products. And I'm going to go through very quickly the background of these 3 products. The first one was really introducing this concept of preconditioning, using the preparation on the skin for 2 to 3 weeks, sometimes 4 weeks before a procedure, and showing, you'll see at the top right-hand corner there, where multiple biopsies done, where we show that the preparation actually will change the milieu of that extracellular matrix. It can rejuvenate that extracellular matrix to a major degree, even in that short period of time. So what does that mean? Why should we change that extracellular matrix milieu? Well, we've found that if you can actually change the conversation, in other words, take the old collagen, take the old elastin, replace it with new collagen and new elastin, change the environment there, that the crosstalk between the cells and the proteins, the collagen fibers, the elastin, improves tremendously, so that when you do your procedure, you're going to optimize the healing and the outcomes. So that was the first sort of step that we discovered with our Nectar product. Then we went on to a whole different story with body contouring. At the time, we used it in partnership with cryolipolysis, but really the whole emphasis was when you break down a fat cell, there are very interesting things that happen. The first thing that happens is that a lipid droplet is released from that fat cell. And a lipid droplet is enormous. To get it actually absorbed by a macrophage is a very tough kind of story. But the other thing about the lipid droplet is that it's very pro-inflammatory. And so much of the induration and the swelling and the tightness and the banding that we see relates to those lipid droplets. And a lot of that with the cryolipolysis that we saw during the period that we called apoptosis was really related to that lipid droplet. So we found a way using a technique called, or using a modality of autophagy or lipophagy, where we could break down that lipid droplet much smaller and get it absorbed by the macrophage more efficiently. So that was the second product in the body range. And we also went into this in a lot more detail, is what happens when they break down that fat cell? What are the various steps? And can we actually reverse the steps of this great inflammation that happens when you release these lipid droplets? And that is the adipocytolysis that we published. If we could get the macrophages to absorb lipid droplets, could we get it to absorb red blood cells? So this product was created really looking at bruising and looking at decreasing bruising, and we had great results from that. We also added to that product a molecule called lactoferrin, which is one of my favorites, but it also has great effect against biofilm, so we had some good biofilm results. And then finally, if we're going to have a product that we're using in invasive surgery, we should tackle the scarring and see what we can do to try and decrease the amount of hypertrophic scarring or ordinary scarring that is occurring. So we added various agents. Tetrandrine is a new agent that hasn't been used before, together with our Trihex technology to look at the scarring. And when you look at this all together, basically what we're doing is we're incorporating actives that we've used in various other products, but we're looking at preconditioning, we're looking at getting rid of those lipid droplets early, we're looking at tackling bruising, antimicrobial, looking at the scarring, and then of course at the swelling. So all of those together would describe a perfect kind of peri-operative, invasive operative surgery product. And I must give credit to Dr. Laurie Cassis for doing so many of the preliminary work, or so much of the publications right in the beginning, where she combined 2 of the products that I've just described to you. But from there, and from the experience that we had there, and from the wonderful results that Laurie got, we decided to do a multi-center trial. We did this in 8 different centers throughout the US and in Canada, and really looked at comparative. We had a split body where we used a bland moisturizer on the one side, the body product on the other side, and then we compared these various modalities in terms of bruising, in terms of different effects post-surgery. One of the most important things we wanted to see was related to the lipid droplets. So if it's going to be very pro-inflammatory, really what's happening is that induration and that internal scarring manifests as a subcutaneous fibrous banding, this difficulty that patients have moving immediately afterwards, usually within the 3 to 6 week period. And we wanted to see if we could alleviate that. So yes, we looked at the first lot, and we got our results at 10 to 14 days. The first thing statistically significant was the bruising. Okay, that's great. It's good to have improved bruising. We know that it does disappear. But look at what happens with this area of the internal scarring that I'm talking about. So subcutaneous fibrous banding. This is 3 weeks. This is 4 weeks. This is 6 weeks. So essentially, you get statistically significantly decreased fibrous banding. And what does that mean? It means that you can sometimes see this on the patient in terms of the banding. You can sometimes see these tightness and the tight bands that disappear so much faster. But the patient will tell you they feel so much more comfortable, they don't have the restricted movement that they had before, and the pain and the induration and the banding is much improved. So this is a really exciting concept in that you can get the translation of a topical product that is going to affect the subcutaneous fat underneath. And I know there'll be many questions about how do you get it absorbed. We've got all the answers to that, and why should it work at such a depth. We've done gene expression, we've done the whole gamut of different tests that will really validate how we're getting these results. So at the end of the day, with these couple of minutes, really what I wanted to do was introduce, number one, the concept of using a topical to have effect on invasive surgery, which is a really new kind of concept. And then secondly, to see, okay, where are we going to maximize and improve the patient's symptomatology as well as in terms of the induration and all the rest of it. So I thank you for your time and happy to take any questions if there are.